Alright, what's going on, y'all? So today I'm going to talk to you about the differences between regular TRT, testosterone replacement therapy, and sports TRT. I'm going to tell you how each one is classified, and then what I've done in the past and what I'm currently doing. So this is definitely not something I recommend for most people. This is definitely more of an aggressive strategy that's usually utilized for very, very competitive bodybuilders. So if you are someone that is just on TRT for life, or you're just trying to do, one or two steroid cycles and call it quits, this is absolutely not something I recommend. So when it comes to regular TRT, testosterone replacement therapy, this is what you'll find doctors or clinics prescribing. So, as you get older in age, typically your testosterone levels decrease. I'm finding even young guys that come to me now, there's so many young guys that have suboptimal testosterone ranges that if they were to go get tested by their doctor, there'd be a good chance that they would be put on TRT by their doctor. Typically, they're looking when you get blood work, doctor gets blood work, they're looking for your testosterone in a range between 300 and 1100 nanograms per deciliter. And to get that, they'll typically prescribe somewhere in the range of 120 to 200 milligrams per week. Typically, that's going to put you right into the higher end of normal for testosterone. And that's what a doctor, at least someone who knows what they're doing, is going to try to do. If you're finding a doctor that he's putting you on amount of testosterone that keeps you at 300 to 500 nanograms per deciliter, that's pretty low. And the quality of life on the low end of testosterone, the low medium end, compared to just the high end of the normal range, is quite different. So just being at say 1,000 nanograms per deciliter versus 500, there are marked differences between, your libido, your energy throughout the day, your strength, your quality of life, all of that. So that's when you have regular TRT. With bodybuilding, typically, in the old days, you would see guys, they would run a steroid cycle, it could be testosterone alone, or it could be, testosterone with other compounds. They'd run their steroid cycle, and then they'd come completely off, and meaning they'd pull everything, including testosterone, and then they do a post-cycle therapy, and then they'd get their levels back up to their normal range. The thing is, now the strategies change for a couple reasons. Now, most competitive bodybuilders are doing what's called blasting and cruising. So they'll run their steroid cycle, that's the blast, and then they'll do their cruise, and that's typically when they come down to TRT levels. The reason why is, typically now when you go ahead and just pull testosterone completely out, if you've been on your steroid cycle, it shuts you down. When you come completely off, your testosterone levels are now lower than what they were naturally. So it takes time to get back up to a natural level. This can cause, anxiety, depression, obviously a huge decrease in strength. You're going to lose quite a bit of mass that you even put on during that steroid cycle. And so now, with bodybuilding getting bigger and bigger and bigger, you typically want to go ahead and come down to a cruise dose of TRT. Most bodybuilders that, they've been doing this for a minute, they decide that they're going to be on testosterone replacement therapy for life. And, another reason is that with our environmental factors, with what's in our food, just the air we're breathing, all of that is causing testosterone levels to decrease much faster than what they did, just 30, 40 years ago. So most guys are just deciding to be on TRT for life. So, what I've done in the past, what most bodybuilders do is they'll do their steroid cycle and then they'll come down to their cruise dose. For me in the past, it's been 200 milligrams per week. That puts me right at the top end of the normal range or just slightly over. And that's what they would do for, typically, 8 to 12 weeks. Some guys run, their cruise a little bit longer if they're doing, say only a prep cycle a year. And then some guys will, only do a health phase for say 6 to 8 weeks if they're really, really aggressive and all of that. Whenever I've run 200 milligrams a week, my last cruise, when I got blood work, my blood work was fantastic. On 200 milligrams of testosterone per week, my blood work looked way better than when I was an ultra runner, a natural ultra runner. So that should kind of put it in perspective. If you are, natural and you are having suboptimal testosterone ranges, TRT absolutely can actually help you be healthier across the board with your health markers. Sports TRT is more of an aggressive method. So this is something that I've only seen with, really kind of the big boy bodybuilders, someone that's got quite a bit of mass. Whenever you go from your steroid cycle down to cruise dose, even if, 200 milligrams per week, you're not going to keep all the size you put on with that steroid cycle. It's like taking, 2 steps back. And, then when you go ahead and run your next cycle, it should be like 4 steps forward. So it's like 2 steps back, 4 steps forward, 2 steps back. That's why you see guys year after year after year get bigger and bigger and bigger. But some guys want to take it to another level. And with that, the more size you have on your frame, the more testosterone it takes to keep that. So depending on how aggressive you are with your goals, some guys decide to run sports TRT. And I've seen the ranges of what this is vary, but a very, very popular kind of method was put out by Broderick Chavez, and a lot of guys follow this, and it's 3 times your weight in kilograms. So for me, I'm 240 pounds right now, so 3 times that. So 240 pounds is 108 kilograms. 3 times that comes out to a little over 320. So what he suggests, and what a lot of guys end up doing, is 3 times their weight in kilograms. For me, that would be 320 milligrams per week. That's not currently what I'm doing, but that's going to keep most of the mass on your frame, and you might even be able to grow on that. This is more of an aggressive strategy. Like I said, you come down to your cruise dose, so you're not just blasting all the time. If you're blasting all the time, your health markers are going to be out of whack that entire time. The time you come down to cruise is the time is supposed to be a health phase to get your health markers in check and give your body a break. It's not like you just want to go ahead and come down to cruise dose, go get blood work, you see everything's good for that split second, and you just jump right back on cycle. If that were the case, I could essentially get off a steroid cycle, and within 3 weeks, I'd have great blood work, and I could go ahead and blast again. You want to give your body an actual break, so the majority of the year, the health markers aren't out of whack. But with sports TRT, depending on your individual response to steroids, you might have healthy-ish blood work on even sports TRT. So with sports TRT, most guys will run that method, the 3 times your weight in kilograms. I've seen some guys cruise on 500 milligrams of test per week. My opinion, you're running a full-on steroid cycle. Your health markers most likely aren't going to be looking perfect on that, and you're not giving your body a true break. But I do know several pro bodybuilders that they will cruise on 500 milligrams per week. Like I said in the past, all my cruises have been at 200 milligrams per week. What I'm currently doing and testing out is I'm currently cruising on 250 milligrams per week. So like I said, my weight currently right now, my cruise dose, if I was following the Broderick Chavez sports TRT, method, it would be about 320 milligrams per week. I'm kind of cutting it in the middle. So right now I'm testing 250 milligrams of test per week, and I've got 4 IUs of GH per day. And that's what I'm doing during this cruise phase. I'm going to go ahead, get blood work done in the next week or 2, and see how my blood work's looking on 250 milligrams per week. If anything looks out of whack or, doesn't look great, I will be pulling my dose down even more. My whole thing with this is I want longevity in this sport, and I want to do this as healthy as possible because, blasting steroids, at the end of the day, it's just not healthy. And I'm going to talk to you guys in another video about individual response to steroids because I've managed so many guys now. I've been coaching for several years now, and I've seen the individual response of steroids vary drastically among people. So I'll talk to you guys about that in another video. But, I might even be fine on 320 milligrams, of testosterone per week. But, I'm not really comfortable at this point doing that. So I'm doing 250 milligrams with 4 IUs of GH. And that's what I'm classifying as sports TRT right now. So I'm not on legitimate TRT. Legitimate TRT would be somewhere in the range, like I said, of probably for me, it'd be about 160 to 200 milligrams per week, me knowing my blood work. But, that would be true TRT. This is sports TRT. Sports TRT is going to be anything over what would put you in a normal range. And if you have those aggressive goals, you have a lot of size on your frame, and your blood work looks great, this is where, you might want to think about doing this. I'm absolutely not suggesting you do this because this is not the healthy method, but there are a lot of people out there running sports TRT rather than just true TRT. So I wanted to put that out there. I've gotten the question several times of, what's true TRT, what's sports TRT, because I've used the phrase several times. That's the difference. So true TRT, typically 120 milligrams to 200 milligrams per week is typically what the doctor's going to prescribe. Sports TRT is anything over that, and the very popular method is 3 times your weight in kilograms. And then you'll do that for, a good period of time before you go ahead and get on your next blast. Obviously, you need to be paying attention to not only blood work, your blood pressure, your blood sugar, all of that. Make sure you're as safe as possible doing this. But I hope you guys got something out of this. If you did, please go ahead and smash that like button, hit subscribe if you haven't already. Be happy, be positive, be powerful, and have a great rest of your day.